Yes, doctor. Can you say a few words about the demo?
Good evening to all and a happy anniversary. Dr. Nikhil, who is going to demonstrate. Actually, if you look in medicine, the most toughest thing is remembering medicine names. So we need to remember a lot of medicines, their dosages and their side effects and classification where does it come. So the ideal way is to show this demonstration to know where this drugs come under, which classification. Once you know this classification, you know the mechanism and side effects and all that. So Dr. Nikhil will be showing this, and apart from that, he is also going to show other inventions, whatever ophthalmic inventions the scientist and the as a second set. This is for doctors. Now we have Google and you can search, but ideally any doctor, we actually need to know the drug name, the dosage, so that we give a proper dosage to the patients. So Nikhil will demonstrate on this classification of drugs and how to recollect them. Dr. Nikhil, all the best.
Thank you, Dr. Sudhir.
Thank you, sir, for kind introduction. Thank you, sir.
Yes. All of us know Dolo, or let me say Saridon. But what is the base of it, how it is formed? And as I was interacting with him, it was really surprising to know that even many doctors don't know. They know only by the tablet name, may not be by the classification. So if we give a wrong classification medicine, which is a little higher powerful straight away, then there is a possibility of superbug also, which is really scary. So here we have, it is going to take some time for us to understand what is going to do. Let me try to explain it further. See, these are all medicine names. I'm sure you can play a game with remembering the spellings and whatnot. Suppose if I'm going to ask him, Dr. Nikhil, can you tell me all the 14-membered ring medicines?
14-membered ring are basically, these are membered ring which are molecular structures of the drugs, which we actually don't think of remembering during prescribing. But to remember that way is, there are aminoglycosides, which are 14-membered ring, which are ketolates and the normal ABC group. So that concludes erythromycin, roxithromycin, erythromycin, clarithromycin, chloromycin. Yeah.
Sulfadoxine.
Sulfadoxine.
Yeah.
Is a sulfonamide classification of groups, drugs,
yes,
in which it is a long-acting one.
Long-acting, that's right, long-acting sulfonamide. Next slide.
Nikhil, sulfamethoxazole, famous drug.
Yes, sir. Sulfamethoxazole is again a sulfonamide, which is a sulfa group of drugs, and it's an intermediate acting, sir.
Yes, it is intermediate. There are plenty of questions to ask here. I will ask which is easy. Okay, ampicillin. Somebody has asked ampicillin.
Ampicillin comes under the aminopenicillins, which are the extended spectrum ones, which come in the middle group of penicillin group of drugs, which is semi-synthetic ones.
Can you point out, Geeta, if you can? So penicillin, semi-synthetic penicillins, in that extended spectrum penicillins.
And then aminopenicillins, in which ampicillin comes. So it's a 5-generation.
5 generation. I think it will take generations for non-Maxonians to do this. Okay. Tazobactam.
Tazobactam is extended spectrum penicillins, which are the most advanced drugs. Means none of penicillin works, then tazobactam comes in the picture.
Okay, it comes under a specific
broad spectrum.
Broad spectrum. You have a different name here. It is listed as similar to semi-synthetic penicillins. There is one more category.
Like the synthetic one, the finest one, the tazobactam, sulbactam, those drugs.
Yes, that is correct. It is, your typing skills are tested now. Albendazole.
Oh, albendazole is basically against all the worms in the stomach. I can name them from the start. Roundworm, pinworm, hookworm. Then comes the whipworm. Then comes the filariasis. Then hydrated disc. Then whipworm. Then Trichinella spiralis. And all the worms basically. Albendazole is used.
Yeah, I think this medicine is Joe root of all medicines.
Yeah.
As much as Joe root of England, this is Joe root of all medicines.
Yes.
Next, please. Okay, somebody's typing. Tetracycline.
Tetracycline is another group of drug, but it also comes as a amoebicidal drug, in which it is a luminal amoebicide.
Yes.
And it comes under antibiotic, the last classification.
Yes, it is. Okay. Chloroquine.
Chloroquine is a basically anti-malarial drug, but it is also given to the worms in the stomach, anti-amoebic drugs, what we call it as.
Yes.
And it is an extra-intestinal amoebiasis, which is out of the intestine which amoebiasis occur. It is a tissue amoebicillin.
Excellent, excellent. Next slide, please. This is a cute tree here. We have Dapsum. Oh, easy to type.
Oh, Dapsone is an anti-leprosy drug, which is the master of all drugs, which used to be given for leprosy patients extensively. It is a sulfone derivative.
Yes, sulfone derivative. People search cell phone, but you are able to say just like that. Okay, Amica.
Amikacin?
Yeah, I think Amicacin. Yeah.
Amikacin, it is a basically fluoroquinolone kind of drug, which is a second line of drugs given for the anti-TB, sir.
Yes, anti-tubercular. Group 2. Yes, it is. Okay, probably last two. Clofazimine.
Clofazimine.
Yeah,
Clofazimine comes as a line 5 drug for anti-tuberculosis also.
Yes.
And it's a phenazine derivative. It also comes for anti-leprosy drug also.
Can you go back and let us check? Can you go to the previous slide? What did you say, Doctor? Anti?
It's an anti-TB line 5 drug, sir.
Anti-TB, yes, that was true. You said something
And
else.
it's also anti-leprosy drug, sir. Phenazine derivative.
Okay, next slide. Probably the last. We'll take two more from this. Okay. Cefixime.
Cefixime
Yeah.
is a cephalosporin, which is a big brother of penicillin. Basically, cephalosporin have 5 generations. So cefixime comes under 3rd generation.
Cefixime.
In the 3rd generation, it's an oral cephalosporin.
Yes, it is oral. Probably the last one. Okay, somebody wants all the 3rd gen cephalosporins parenteral.
Okay, parenteral. It is ceftriaxone, ceftazidime, cefoperazone, ceftriaxone, ceftazidime.
Ceftazidime.
I'm repeating, I guess, ceftazidime. 5th one is ceftriaxone.
Yes, it is.
Dr. Nikhil, Dr. Nikhil,
Yes, sir.
I would like to ask a different question.
Yes, sir.
How much time you took to do this memory?
So, sir, in between emergencies, I was almost ready to give up 2 days back. Venkat sir was one who promoted, doctor, whatever you're doing, just go on.
That's
So, yeah.
fine. How much time? How many hours roughly?
Roughly, sir, I would say, if sincerely counted, it's 1.5 hours for all the demos.
So totally?
1.5 hours totally, sir, start to end.
Incredible even to me. Okay, 1.5 hours. Let me say very magnanimously 1.5 days.
1.5.
Let me no, not that you are lying. I'm only saying let it be even 1.5 months. Dr. Nikhil, what is your experience as a doctor? How many years old?
Okay, shall I remove it, sir?
Please,
Yes.
please.
How many years since you are a doctor?
I am a doctor since now 2011. 10 years, sir, 10 years.
10 years. And before that, another 7-8 years doctor studying.
No, sir, including studying 10 years, sir.
Okay, 10 years.
Yeah.
So what you could not do in 10 years time, you could do not even in 10 days, not even in 10 hours. Hats off to you. That is what is the efficacy of a technique. Congratulations.
Yeah, it's only technique, sir. It's only technique. It can't
Yes.
happen with mugging.
Yes.